We are Healthcare Partners of Nevada. We promise to earn and keep your trust.
We promise to treat you like family.
We promise.
We promise to be an important part of the prompt community.
We are Healthcare Partners of Nevada.
We're Healthcare Partners of Nevada.
We are Healthcare Partners of Nevada.
Contact us today to learn more about our promise to patients and to find out how you can see a Healthcare Partners doctor.
I'm here with Dr. Bensler, who is a cardiac electrophysiologist. That's a mouthful. Tell me about your profession.
Well, cardiac electrophysiologists actually take care of patients with abnormal heart rhythms or arrhythmias. Most people know cardiologists as patients that take care of patients with heart attacks or acute myocardial infarction. Those cardiologists are more or less considered plumbers. We're actually the electricians. We specialize in heart rhythm disorders or patients who have problems with their conduction system of their heart.
Do you find that that's a common problem?
It's actually getting more and more common, especially here in the United States. Unfortunately, as patients age and get a little bit older, they're at higher risk of developing arrhythmias or abnormal heart rhythms. Sometimes the rates can be too slow with the heart, or sometimes the heart rate can actually be too fast. So there's actually a variety of disorders that we're finding that are more common in the elderly population. You can have regular heart rates that are fast and dangerous. One particular type is atrial flutter, which can actually be regular. Another very dangerous type is ventricular tachycardia, which can actually degenerate into ventricular fibrillation, which can cause a cardiac arrest. So even regular heart rhythms sometimes can be dangerous, as well as the irregular heart rhythms.
How does a person find out that they have an irregular heart rhythm? Is it something in a routine checkup that they would find out about, or are they born with this, or it just develops over time?
Well, about 2/3 of patients with arrhythmic heart disease actually can develop symptoms such as shortness of breath, lightheadedness, dizziness, chest discomfort. But unfortunately, about 1/3 of patients can be at risk of complications from arrhythmias and be completely asymptomatic and not know that they have arrhythmias. So most of the time patients present due to symptoms, but if patients are asymptomatic, they can still be discovered with an electrocardiogram or a screening test to make sure that the heart conduction is normal.
Should a person have a regular screening of their heart rhythm?
Well, an electrocardiogram is not a routine part of an annual physical exam, but any symptoms that are suggestive of potential heart rhythm disorders should prompt a primary care provider or any type of healthcare provider to obtain an electrocardiogram to look for evidence of arrhythmic heart disease.
You're here at the Healthcare Partners Specialty Clinic. You're working very closely with cardiologist Dr. Eric.
Yes, I work with Dr. Eric, and Healthcare Partners Cardiology has started a satellite clinic here in Pahrump where one day a month, one of the electrophysiologists from Healthcare Partners in Las Vegas is going to come down to assist Dr. Eric in providing comprehensive care for the patients, including cardiac electrophysiologic consults.